It's kind of chilly in here. It feels a little bit like an ice box. Yeah, emotionally a little bit depleted. Like I'm one of those chicks that's used to getting her way, and thought I did everything right, and I kind of got third graded, right? And like the teacher tells you, well, you should have done this. It's like, well, what did you think I did? You know. So that's what I'm struggling with, really.
Okay, here we go. It's cold in here too, unfortunately, but I do have the bed all warmed up. Okay.
Well, good luck with everything. I say that now because I don't know how many more minutes you've got or we've got before we're watching and you're asleep.
Great. Wow.
What?
I've never seen one of these. But I remember, no.
It's kind of like a garage.
Oh,
high-tech garage.
Yeah, dude. You guys should see this.
They're French.
They're French.
Are these French ones or
Oh.
are these United States?
Huge
Talk
life.
about.
That's your spiritual guru?
Wait, will you green
That's
box
your
me?
spiritual guru.
That's my spiritual guru.
Nice.
So they have, look at these lights overhead.
Oh yeah, look at those.
In the other room, they're all different colors, but when they come together, it's just a pure white. It's
Oh.
weird.
Pure. I need some pure energy. Some positive energy.
Oh, yes.
Always.
Okay, honey, we're going to have you shut that and get you over here on the bed.
What you guys in? What are we
They're
going to do
actually going to, they're going to be filming us.
Okay.
Not live doing it because we can't do that.
Okay.
So if I'd love to be able to put it somewhere so that it gets just a general area of what's going on,
Is
that'd
that
be
it?
awesome.
Or is that
What's this?
another spot?
That one is going to be connected to his
Okay.
Oh,
here.
forehead.
Yeah, that's okay.
The third eye, we call it.
Yes.
Third eye.
All right, Donna, you want to set that
Yeah,
up?
we could put on the
Yeah,
anesthesia card.
You guys have been
Get
so
Dr.
great.
Gibbs. Hold Dr. Gibbs, please. I have a partner. I have a partner that's a techno geek,
Yes.
and he would know what to do. Me, I just monitor it to make sure my kids aren't doing something they shouldn't. Yes, sir.
So how many people are in the room then? We've got Hermine laying down. We've got 1, 2, 3, at least 4 other people in there, I can see.
Oh, man.
So I meant medical personnel in the room.
I sure hope I don't drop
see.
it. Man, I feel like I'm going to drop this computer.
It's filling up now.
Probably not. You're right. I just don't want the battery to wear out right at the good point.
We'll make sure the computer and the webcam are sterile. Not going to get that close, are they?
What's that? Oh, chilling. Yes. Oh, he hit that way before your feet.
Okay.
Where's Gary gone down? Is he coming back?
Move that way.
Yes, I'm going to take the bedroom.
Mm-hmm.
Do you mind if we give you a little blessing? You're not blonde, are you? Are you blonde? You're pretty blonde. Well, that's right, you are blonde. Donna, she is a blonde. That's her real name.
Oh, that's right.
So the time everyone's watching at is 9:18 Pacific time. Is that right? On Wednesday, the 16th of May, 2012.
Golf ball. And then now that I use a brain monitor for it, that even just strangers ask about it. Hey, good luck, or don't break it, don't think of anything too much.
Can you hear me okay, Dan? I'm on a webcam mic instead of my headset mic.
Can you bring on towards the bottom of that a little bit? I think we're going to try to hold up the side.
Wiggle, 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 wiggle. There you go. Just a little bit more.
That's it.
That's perfect. Lean
Right,
back.
so at this stage, Hermine is still awake, isn't she? Because I can hear that she's been asked to wiggle her feet around
All of
to
yours.
get organised.
You think it's something good?
Yeah.
Just something to like.
Hey, Monica.
There's some guys back here. It looks like they're. Hey guys, everybody there?
Yeah, we're good, thank you. We're good.
Hey, tell her good night. Oh.
Sleep well, Hermine. See you in a minute. Feel like 2.5 minutes.
Try to go to the settings on the gear setting in the
There we go. There's a gentleman over the far side in some dark scrubs with a headset on.
Just monitor. You know what she's talking about?
Yes, you have to go to the gear
It's going to go from, like,
I
live.
think that one in the back is okay. You want me to do the one down at the foot, right?
The one more in the doctor has the
Right.
Go.
Hey, Melissa.
Hey, is the surgery going on right now?
No, Hermine's just about to be anaesthetised, we think. She was just wiggling her toes, but I think there's some gas on her now. So we're a
Is
few
this the
minutes
view
away
we're
from
going to
start.
get? Is this the view we're going to get of it, or are we getting a closer view?
I think there is another webcam that's going to go on the surgeon's head.
Oh my gosh. Okay. I
There
want
is
to
a
say hi to
gentleman.
everybody, but I've got to get the hell out because I cannot watch it. I will literally, I'll probably be the first person to throw up live on a hangout or pass out. I don't want to have that title. So
Okay.
I say, awesome that all of you guys are there, and I give you thumbs up and good luck with watching it. And this is so awesome. I got to head out. All right.
Not sleep now, honey.
Yeah, and I would need a trash can and smelling salt and somebody to pick me up off the floor. This is awesome though, you guys. Have fun.
See you later, bye.
Bye.
That's a great question, Paul.
You put the computer on top.
Line in the filter.
How many invites are out, Dan? Okay. So we think. Did you get a plus name mention for it, Monica, or did you just see it?
I got an invite that popped up in the chat, but I didn't get the little plus thing.
The alert, right, okay.
And those have not been always coming lately. There's just a technical error.
Yeah. I can, yeah, I'm back. Excuse me. Yeah. Very good. Good morning, Mike and Monica. Did you bring them up to speed with, I wonder if he can see us. I wonder if it's Dr. Duperior. Do you know if he's able to hear us, Dan?
I'm going to assume he can't.
It looks like we've got two pictures from the OR.
No.
Oh, dear, and then we fix my music.
Somebody's got something on their head. It may be the surgeon. He may have an operating microscope and light. Sometimes the surgeons, when they do small... Excuse me.
Yeah, there's we can see the other laptop on the other side of the room, can't we? So what's that angle?
Be right back, Dan.
It's better, but still not good. Come die.
Sorry. Yeah.
Ready?
Are you ready?
There shouldn't be any issue getting in, should there? Because they're all on named accounts as opposed to the page account.
All ready? All right, I got the head. Almost ready. Lean
I could
back.
throw a few individual plus names out there.
Okay,
Bueno.
Okay.
I'm back here and I'll do some explanations of what's going on here. The surgeon there with that thing on his head has got a binocular operating loops, gives them magnification. They're fairly powerful. There's also a light that comes down between his eyes. And the thyroid is in an area where there's many, many delicate
I can't get this
structures.
camera to even come up.
There are
It's frozen. It
nerves.
won't do anything now.
Boys are gone.
It came up to select it. I selected the camera, and then it just froze up. Right, you need to keep doing what you're doing. I'll keep messing with this till.
The thyroid is surrounded by a lot of delicate nerves, some of which go to the voice box, and some of which go down into the chest cavity and control some of the
Oh,
things
there
in
we
the
go.
chest cavity.
Something happened there.
And if they injure any of those nerves, the patient can wind up losing their voice, have a very hoarse voice.
There's something wrong with our surgical lines. Not working.
I think they can see the monitors better, can't they?
That's one possibility. The other possibility is that he may just operate with just the light on his head directly. There they go. There they go. There are the lights.
Okay, time out. No wire. And we're doing a total thyroidectomy. And she's got no antibiotics. That's right, 678.
For the viewers on air, this is Dr. Levin again. They're getting things set up in the operating room now to operate. They're testing things out. Apparently, Hermine must be asleep already.
Yeah, but I can't even get it to have an image, so I don't know what to do with it.
Most of the people around there are
I
surgical
can't give you something
surgical
now.
nurses.
The course of
I believe the anesthesiologist is in the back. I'm trying to figure out which way the
Yeah, I
table is
can't
oriented.
close out
I think,
what it's doing.
okay, there's her
I don't
head,
do anything with it.
and you can see the tubes
I don't
going
know
up. She's
enough
been
about this
intubated,
stuff,
so she's
so I
already
start
asleep.
messing with her. I mean, if I power the whole thing off, I won't be able to get it back.
I don't know if they can see us or hear us. The surgeon's going out now to scrub. The pink tube you're seeing there comes from a ventilator which will control her breathing, and the way they do that is she's actually right now she's paralyzed. They've given her an agent which actually keeps her muscles from functioning, so she's not breathing on her own. They're monitoring her oxygen saturation and her blood pressure. Most of her body will be completely covered up. They'll have a little area around the thyroid in the front of her neck exposed, and they'll have a drape
Like that game I played online.
with adhesive that seals the skin around where they're working so there won't be any
Where the money
contamination.
comes out.
The fellow with his back to us is the anesthesiologist, who usually is a board certified. He's also usually an MD, and he specializes in anesthesia. The anesthesiologist is there to monitor her vital signs, and probably the most important thing he has to do is, it's fairly easy to put a patient to sleep. The trick is waking them up correctly without having problems. When the person is put to sleep, the two riskiest period is the period where they're undergoing what we call induction. Because the nervous system goes to sleep at different times. And sometimes it's what's called an excitatory phase, where the patient will actually, they'll be unconscious, but their autonomic system starts overreacting in terms of breathing. And are they using an ordinary webcam for Dan? Because the video actually looks fairly good. Those are operating loops. They magnify the image, and some of the time they have a fiber optic light thing that's coming down over his forehead, the white thing. That directs light between his eyes, so the illumination is what we call coaxial. So it creates a very good lighting situation where there's no abnormal reflections. And he's got good depth perception with that microscope he's got in his head. Sometimes they'll use an operating microscope, which is actually fixed on a stand. But this gives him the ability to move around quite a bit. He's got a very wide field of view. Right. Yeah, they're finished. Right, they're finishing up the prep and drape. This fellow on the left is probably the assistant surgeon. The primary surgeon is on the right, the assistant is on the left. These are scrub techs in the back to get the equipment and the instruments all ready for them to use. Now, you know, this brings to mind why it doesn't look like we're going to get a direct. We're not going to get a direct view of the incision unless that's his camera on his head. But it doesn't look like he's wearing head cam.
Okay, that's fine.
Yeah, he's pretty much concentrating on what he's doing now. One of the issues, you know, in some ways, Hermine was trying to do this do-it-yourself. And I think what you have to do is involve the biomedical department, or even some hospitals have a photographer, a professional photographer on board. And they probably wanted to have someone like that was responsible for the hospital controlling what was going on. And that would be one of the things that we might think about in the future, is having one of the people who are involved in medical photography or medical devices that do these things around the hospital. They have professional videographers and photographers, and had we involved them early on, I think it would have helped a lot. It's a little bit too dicey having the patient in there being responsible.
Yes, we can hear you.
Okay. I tried to get the other video camera, the one that Dr. Duperior was supposed to be wearing, to work, but it looks like the other laptop just kind of froze up when I plugged it into it. Okay.
Who are we talking to?
Are you guys okay with it? I don't have the headlight camera hooked up. Unless somebody can walk me through another way to try to get her computer to work better. Okay. It won't let me move the icon at all. Okay. Yeah, we can try. Let me try this one since I can't get that one to do it. Sure.
Can they see us, Dan? Yeah, we might just tell him that I'm here and I'm a physician, kind of watching what's going on and doing a running moderation in terms of what's going on.
Yeah.
What I'll do is I'll screen share so he knows.
It looks like they're making the initial incision there through the skin in the anterior neck. So do
If
we
he,
have two,
if he gets
two
sight of
separate
my
streams?
screen, he can perhaps talk him through that.
Okay, no, I have it plugged into the USB port. Where should I go from here?
You gotta plug in it.
Okay. Right. And then it has built-in insight, and it has Logitech camera. So I'm going to select the Logitech camera. Okay.
There, yeah, that's it.
Okay. I don't know why it wouldn't work on the other one.
Oh, that's a good image.
Wow, wow.
That's excellent. That's high def. Yeah. So are we? Is that fellow the anesthesiologist? Can you hear me? Yeah. Okay. Excellent. That's okay. All right. Well, Pete can hear me.
You okay?
Oh yeah, this is great.
Oh, right, okay.
Well, we really should thank Dr. Duperior for allowing us to watch this case. I don't know if you can hear me or not, but this is Dr. Levin, who is a retired surgeon, actually an ophthalmologist, and I've operated many patients with thyroid eye disease. So he's using an electric cautery there to control bleeding. So you really are not going to see much blood here because the key to surgery is controlling blood loss. You have to be able to see to operate. And if you are able to control the bleeding, you're able to really see the anatomy real well. Those little instruments that look like scissors are hemostats, which they put on vessels to stop bleeding if the cautery doesn't control, and if that doesn't work, they will actually use a little suture to tie the blood vessels off. I think they're exposing, they've opened the skin, they've probably gone through some subcutaneous fascia, which is connective tissue, and they're probably trying to expose the thyroid gland and they're controlling bleeding as we go along. You notice it really takes 4 hands here. It's always, you can do this surgery alone, but it's always great to have a backup surgeon, not just only in case something happens to the primary surgeon, but the 2 extra hands really do a lot, because a lot of surgery is not only controlling bleeding, but exposing the tissue, and the assistant surgeon uses retractors to expose the surgeon, to expose the tissues.
How are you finding our video equipment from F.A.C.S?
Are we allowed to share any stills, even long distance stills? No. Yeah. Yeah.
It looks to me like, based upon how they're redraping the patient, they're getting pretty close to the thyroid gland, and this initial period they probably could expose the gland. Now they're putting additional drapes on there to avoid any possibility of contamination. They've just put a new sterile field on there.
Plus, you can use it when you go home.
So maybe if the fellow who's using the camera can possibly, when he won't be in the way, if he can get a little bit of a more direct view of the incisions, even if it's just for a few seconds, if the Dr. Duperior won't mind, just to ask him when a good time will be. And yeah, I don't know if they. I don't think that's a problem. No, instantaneous screen shares.
I wouldn't want to share anything close. No, no.
There is a patient under there. I think we as surgeons sometimes tend to forget there's a patient under there because everything is so sterile, isolated, and anonymous. And Dan, even though this is being recorded, I want to remind you not to use identifying information. That noise is the cautery. It has an audible alarm, so everybody in the room knows that it's on. Now, another important feature is to know that the oxygen has to be isolated in that tube because there are explosive fires. There have been fires in the operating room from cauteries coming in contact with the oxygen flow. It's 100% oxygen. Sometimes it'll catch a drape on a fire, and before you know it, you've got an explosive situation. People have been damaged and killed in that situation. You might even notice that there's actually a surgical tech, the lady in the pink hat. She's also retracting tissue as well. So they've got 6 hands in there in a small space. But they're actually using retractors and very fine hooks. Very delicate hooks because that's very delicate tissue they're operating on in her neck. If anybody who's watching, I guess, in the chat room, or if anybody has any questions, let me know, and I'll try to address them. Okay. Okay. I'm going to be doing a little screen share to show you folks some anatomy.
Zoom it in. Make sure you're well done.
Me too, thanks, Ned. Uh-oh. That's kind of
Okay, can you see my screen share? I have a picture there. So I just want to give you some. Are you able to see my cursor?
Yes, we are.
Okay, this is actually a view. This is actually a bigger area that's exposed than the incision. The incision is really pretty small. It's just across here, and they're able to pull the tissues back. So you can see there's a lot of vital things in the neck. There's the jugular vein, there's a carotid artery. This is the thyroid right here, with the arteries and veins going to it. And this little thing is, it's called the isthmus. About maybe 50% of patients have this thing going up in front of the. It's actually the Adam's apple. This little piece of cartilage, part of the voice box. It's called the cricothyroid, and the thyroid is really wrapped around here. Now, in some cases where patients have goiter, where the thyroid is very enlarged, this gland will be enlarged, and it can actually cause respiratory problems, squeezing on the trachea. Now here you see the trachea going down into the chest, and eventually it will bifurcate into the bronchi. Now let me find another image here for you to look at.
And this procedure, Gary, is a double thyroidectomy, isn't it?
Well, it's a
Full
total
removal. Yeah.
thyroidectomy, right?
Yeah. Because I just read about, for those who are watching, it's like shaped like a shield or a butterfly, and sometimes you can have half out. Is that right?
Right, exactly. Sometimes it'll be a nodule. Sometimes it's a thyroid nodule, which is benign in one part of the thyroid, and then they can excise that part of the thyroid instead of taking the whole thing out.
That image there shows it really clearly, doesn't it? Looking like a butterfly.
Yeah, this is an example of the thyroid, and here is a view of the thyroid in the neck. And I'm trying to find another close-up here. There's a pretty good view here.
Yes,
that's a pretty good structural drawing of the larynx and the trachea. Are these images showing up pretty well on the screen share?
They are. You just have to put an image up and wait for about 4 or 5 seconds for the video to become solid.
Yeah. Is it a 7 or a 6?
6.
There we go. So what is that going in? It looks like a little device with a blue lead coming out the back of it. Let's just see that. Or is that the same cauterizer that we had before?
Yes, I'm not seeing that screen right now.
Oh, okay. It's actually the item that is it's a device that's actually sat on the green towel. It looks like a pair of scissors with 2 black circles.
Okay, we'll go back to there. It's probably some kind of a clamp.
I think it's a little bit more complex than that. Can you see it? It's like got a white and silver center with a black end, and then it's got
on the left or on the right?
It's on the green towel. There's like a green mat.
Oh, this thing over here? Yeah, okay.
Yeah, on the bottom right.
I believe that's a stapler for stapling things.
Yeah.
Yeah, sometimes instead of sutures they'll use staples.
Okay.
Alright, here's where I want to finish. I'm putting this next picture up as an example of thyroid eye disease. We talked earlier about patients having prominent eyes. Here's a lady who presented with thyroid exophthalmos, which we also is known as Graves' disease. Our patient had Graves' disease and had similar appearance of her eyes, not as severe. This is preoperatively. You notice her eyelids are retracted and her eyes look very prominent. And this is her appearance after the surgery. And this is all secondary to the metabolic effects of the thyroid hormone. Are you able to see that pretty good? Pretty well? Okay, very good. Sure.
He's put it on the clamp now. It's on one of the IV like tripods.
I'll just let you know when I find something interesting, so you can keep your camera on the.
So Gary, I wondered if you had talked about endocrine disruption, and there was a great article in the New York Times recently about the rising incidence of endocrine disruption and endocrine disorders, and the connection they've made to BPA, the chemical that's in most plastics.
No, Monica, I'm pretty much focused on the operating room and the play-by-play.
Okay, well I can look up that article if you want.
You're probably referring to the effects of all the plastics in our environment and polyvinyl compounds, some of which actually have hormonal activities. It's been shown that some of these plastics have an estrogenic effect, unlike the thyroid. They found that one of the things that has been occurring is they've been noticing that puberty appears to be occurring earlier and earlier in women. And some of the analysis is pointing towards some of these plastics that are present everywhere.
Yeah,
or even hormones that are injected to our livestock to increase their weight.
Another major source of concern is we coat the inside of canned goods with this, these endocrine disruptors, which are BPA.
Mm-hmm.
But the FDA failed to ban it earlier this year, even though they had a chance to do it. And it's like we don't even eat canned goods anymore because we just don't want to ingest that sort of toxic stuff. And I like my water bottle, I don't use a plastic one. And if you drink out of a metal one, it's coated with the BPA as well. Like I use one that's got glass and then it's got plastic on the outside. But here, I'll put this link in the chat if either of you want to read it.
Now, some of the time, some surgeons like to do this operation through what is called a laparoscope. You probably all have heard about abdominal laparoscopies for gallbladders, but there's actually a way to do this procedure so there's no visible scar. And they actually will make the incision on the breast. And if some surgeons want to really hide the wound, they'll actually make an incision right around the nipple and go all the way up through the anterior chest wall of the tube, which has a light, and they are able to insert instruments through another place, and they're actually able to visualize the thyroid inside the neck without having an external wound. Of course, that gives the advantage of having a very quick recovery time. That type of surgery frequently can be done as an outpatient. Now, Hermine's probably going to be in there overnight.
I imagine so, yeah.
Yeah. Yeah, that's the cautery. I think he must have been. The machine he's using to control bleeding, it has an auditory alarm so they know when it's on and when it's off. And I was explaining the reason they want to know that is because there's oxygen flowing through that area, under the drape, through the tube, and if that spark or the cautery were to come in contact with the oxygen in the drapes, it would be explosive. The concentration of oxygen is that high. It wouldn't just be a matter of the drape just catching on fire. It would just be a very fast flash. Sort of, you probably may remember what happened in that capsule that the astronauts died in. They were in a pure oxygen environment. They had a little spark and it just set off a conflagration and an explosion. And that has happened in operating rooms before where people have been badly damaged patients will die because the flame actually follows the oxygen back into the lungs and more or less flashes the lungs from inside out. Well, he's using a variety of medications. Some of the anesthetic is actually given intravenously and not through a mask. There are different things they use to sedate people, like pentothal, and they also paralyze the patient using succinylcholine, so their muscles are totally relaxed when they put the tube in. Otherwise, the larynx would go into spasms. So the anesthesia includes hypnosis, sedation, and paralysis of the muscles. And he's monitoring blood pressure and vital signs, respiratory rates. They have a special device that they measure oxygen saturation, and he's monitoring all of that. He's monitoring the respiration, heart rate, blood pressure. He's actually up at the head of the table closest to the camera, and actually there's a drape that separates the anesthesiologist from the surgical field, so the surgeon's not distracted from what's going on.
I've just put something in the chat, which is the main steps of a thyroidectomy, which is in 14 steps. I don't know if you're able to talk us through, perhaps later on, which step we're on, so we know how we're progressing. I'm figuring step 1, which is the horizontal anterior neck incision with weight ups, I'm assuming. It seems to be very quiet in there. Does that mean that because we're picking up all the sounds, are the surgeons like talking, or is it quite natural just to be getting on with business?
It's sort of a personal experience. Some people like the room dead quiet. Some surgeons like classical music. They sort of play whatever they like. Some people have been known to play hip-hop and rap and all kinds of stuff. Depends on the personality of the surgeon. The surgeon gets the final say on the music. Yeah, well, let me actually, we didn't see the initial part. They probably, after they put her to sleep, they probably actually injected some local anesthetic, some Xylocaine, which has some epinephrine in it, and that also helps to control the bleeding. It's a norepinephrine causing the blood vessels to constrict, so that's another agent that decreases bleeding. And then that's a long-lasting thing, so they will not use any local anesthetic at the end of the procedure. She's probably had some intravenous painkillers as well. I'll probably give her some intravenous morphine or Demerol, something of that nature, which will have a longer-lasting effect after the general anesthesia wears off. Plus, it's also a lingering effect of the general anesthetic, even though it's been stopped. They will, after they've done a multi-layer closure, they'll probably close each plane of tissue in the neck. And then when everything is closed up, they'll probably close the external wound with staples, which come out several days afterwards. And they'll put a compression bandage, nothing really tight around the neck because she has to breathe, but they'll put a compression elastic band, elastic tissue over the wound to kind of just control any bleeding. And then post-operatively, they'll monitor her for any bleeding in the immediate post-operative period. The recovery is pretty quick. She may very well go home tomorrow. Well, they give her oxygen. They'll revive her. She'll wake up pretty quickly.
See what I found? See, I knew I had one.
That's not me.
Oh, I'll get back to this. What they want to do is they want to make sure that the agent they're giving to paralyze her wears off before they wake her up. In fact, it's interesting because the muscle paralysis is pretty profound, and they've actually had patients wake up during the surgery, conscious, unable to move or talk, and it's a very frightening experience. But it's been known to, and that's one of the things the anesthesiologist gets paid very well for, is being able to balance that. And I've always said when I was operating, the anesthesiologist doesn't do much. She gets paid for waking you up. That's why they pay them. Putting a patient to sleep is pretty easy. Waking him up is a little more tricky.
I think you did that once and the patient died. You don't put down the
My wife's making some, she's a nurse, and she makes some funny comments.
What's in the hot today?
She made it very fun. I don't know if you heard what she said, but I won't talk about it right now. But she made a nasty comment about me. My operating.
Yeah, I heard part of it, but I was like, I'm not going to comment.
Well, that's not true. She was just
I was like, no.
she was making a nasty nurse comment about a doctor. She used to run my office. Okay, so I was saying the anesthesiologist is able to monitor the extent that the patient is really asleep by watching the blood pressure and the cardiogram. If the patient's not really anesthetized and they're just paralyzed, you'll see the blood pressure shoot up, the pulse rate go up, and there'll be some other indicators that the patient's not asleep. So they can actually monitor the depth of the anesthesia by watching the vital signs, the pulse and the blood pressure.
Okay, what's going on here now? We on a pause.
Let's see.
Oh, okay. I'm with you.
Yeah, that main camera is frozen.
Unless someone's walked over the wire or something.
Maybe we can get the anesthesiologist's attention. He can look at that or something.
Yeah, there's the wire is being flipped around with the other medicus down below. You can see all the wire moving around.
No, you're.
Halo. I found out his name was Halo.
So.
He scared me from other people.
No, I believe that the shot there, the wide-angle shot, is being shot now from the foot of the table, not the head. So we're looking towards the anesthesiologist. You see that hump in the drapes is actually the anesthesia screen over which they've draped a sterile plate, so that was sterile. I believe that the screen in the back on the right-hand laptop is the frozen view from the mobile camera. Can you all see that?
Yeah, put your hand up there.
Right. That's the frozen.
Yeah.
Yeah, my image, this image is still frozen, but the main wide angle is working just fine. When you're operating on small spaces and very fine small things, the lighting is really critical. You'll notice that they have 3 lights up here. So normal illumination really is not adequate. It's a huge difference in visibility.
Yeah. Thanks. It's all right. I thought we were moving that part.
You'll notice a little background stuff on the operating room. These lights are very mobile. We actually have a lot of ways to move these. They're able to tilt the lights any direction. They're able to move it up and down through this joint, and then these things are actually on sliders that can slide back and forth. You can see these little grooves. They can slide the lights in those grooves. They can also put IV poles, and they can move them up and down, back and forth. You also have supplies are right in the room against the wall here. Backup supplies, fluids, instruments.
Gary.
Hey,
We disconnect.
you don't want to get
You need to go over here and turn it up again, I think.
There he is. I'm going to get his attention. Yep. Yeah, so he's obviously where it's frozen because he's got it on that laptop. Yes, it does. Between the operating room time, and I don't know if that includes the doctor's fees or not. And that's certainly an issue for health reform in terms of what these procedures cost. Our system of reimbursement is very arcane and Byzantine because it'll cost different patients a different amount. If you're insured, that companies frequently have contracts with hospitals that are either prepaid or they're preferred providers, and they get a different rate. If you go to the hospital and you're a cash-paying patient, your bill that they'll show you may be $25,000. And so everything's negotiable, you know, very negotiable. You can actually find out what they're paying and start as that as a point. Also, Medicare has a rule that a hospital cannot charge less than what Medicare has an accepted payment for.
Okay, we're back in. The mobile camera is back working. Thanks for that.
Very good.
Thanks, Scott.
Back on? Yeah. Gone. Here's the best.
I guess we're fortunate that the anesthesiologist has a little background in technology.
Well, you're an all-around
I
guy.
think there's enough technology in that room, isn't there, to
There is.
certainly sort out a webcam. Wow.
Well, I certainly think that Google Plus has beat Facebook on this one, just before their IPO. She'll wake up. She'll wake up and be conscious by the time they take her off the table, or by the time she gets to the recovery area. She may have some amnesia, so the next day she may not remember it. But she'll be talking and she'll be fully awake. That's important because they really make sure that she's intact, that she doesn't have any neurologic problems after the surgery, because certain events can happen under anesthesia that are not apparent. I've always felt like, and I've always told my patients, they say, "Oh, this is a routine procedure, doctor, right? You do it all the time." And I'll say, yes. However, it may be what you think is a minor surgery, but there are no such things as minor surgeons. So the routine thing can catapult itself into a disaster very quickly. Most of the things we see here are preventive measures to prevent those bad things from happening. Anesthesiologist is very critical in an operation.
Samuel?
Yeah, she could be the unthinkable, and she could say, "What's Google Plus?" Yeah, it's like, "What's Google Plus?"
She may forget what she does for a living. I doubt it. She'll be feeling pretty good by the end of the day.
you give them just the anesthesia, what's his name used to?
Who was that?
She might have a little discomfort when she swallows because the neck muscles are involved here and they've gone through some of those neck muscles.
Really?
And one of the first things I'll do in the case of a thyroid operation is ask her to talk to make sure that her vocal cords were not damaged. Sometimes the vocal cords are a little bit traumatized and you may lose some function, but it will usually come back in a couple of days. But that is one of the accepted complications, and in the operative permit, that is one of the things that's outlined to emphasize that that's a possible complication.
Coming up. Good.
They're probably in the middle of this thing. It looks like they're controlling some bleeding. He may be isolating the gland. He frequently use that cautery that he's holding, the white instrument. Will sometimes have a cutting tip, and it'll actually cut tissue and separate it using the cautery. So the bleeding is controlled as they're doing the operation. I haven't seen them remove any tissue yet, so you'll probably see that when he takes it out. He'll drop it into the silver bowl.
Would I be allowed to share that photo? Can you see the one? Are we okay to be in it?
Let me take a look.
The one at the bottom I'll show you is I've glazed over so you can't actually see anything. Look at the bottom. See, I put a big blue blob on it.
Yeah, we can't see that.
Well, yeah. It's just you and me and.
Good try though. Yeah, actually, those instruments he's using.
Are you guys almost done?
He's using a forceps. Somebody asked him if he's almost done, so. It's a soft tissue. It's kind of spongy. It's reddish.
Is it attached though?
It's
Is it attached?
Yeah. Well, it's got blood vessels going into it, and it's also it's encapsulated normally. It's got a capsule around the thyroid, and normally there's a tissue plane that they can usually use retractors to cut it free without actually cutting the gland itself. It's usually encapsulated in some tissue, so it's separated. It's not attached to other organs or other tissues. It's kind of by itself.
Yeah.
So you can see that those loops he has on his glasses there, and frequently doctors have these are custom made, so they have their own refractive error. The prescription is going to be in the glasses. Now these have a certain set working length, so you notice that he's not bending over. He's standing up straight, and that's really important when you're doing surgery. You need to be very comfortable because frequently you're in one position and you don't want to be bending over. That will really produce problems. You get fatigued. So if you're standing up straight and you're working at arm's length where you're comfortable, it's almost like he's writing or just doing something he would normally be doing. So it's a very comfortable position. Because surgeons will sometimes operate, some operations last 4, 5, 6 hours. The thyroid gland actually is a very vascular gland. If you cut something you shouldn't cut, it's going to bleed pretty profusely. So most of the operation is controlling bleeding. The gland can probably actually be shelled out very easily with blunt instruments. So I'm trying to figure out where they are here in the procedure. There's a lot of glare, so you can't really see too well.
Gary, there's a message just going in the chat box.
Monica says she's going to be right back.
No, this one.
Oh, this
I'm not
one.
saying it out loud. It's nothing big deal.
Okay. From the
Which
operating
is-
room, or?
No, it's one of those. Well, it's no big deal. I've had a direct message
Spam?
from your account from Twitter. I think
Oh,
it's one of those things where you need to change your password pretty fast.
Yeah,
I think somebody's.
Yeah, I've had some people tell me that, so that's
Yeah,
something
okay.
I'll do.
No, that's okay. Good.
Somebody said something about it yesterday.
Oh, really? Okay.
Yeah.
Well, the one I've just had was at 5:22, which is just less than an hour ago.
Yep. I'll have to generate a new 128-bit encrypted password.
I'm sure if you do something like ABC 1234, that'd be absolutely fine. I'm just looking through the circle invites again because there was only about 5 or 6 people on it, wasn't there? So, or is there a bigger list that went out? Ah, right. No, I haven't even looked at that one then. Yeah, you're right. Sorry, there was only 6 people in this one. I must have got the wrong one. I'm clicking. I'm just going to read a comment here, which has just been placed on Sarah Hill's stream, which says, in my response to the surgery being live, and you know, we're not broadcasting live, but we did do a still image, and it says, hey, this is from Brandon Robinson. Hey Sarah Hill, I tuned into the pre-surgery earlier when we talked about the upcoming procedure. A guy made a comment about admiring Hermine for doing the Hangout for education purposes. The response blew me away. She exclaimed that for her, doing the Hangout was a huge help because it took away the fear of the procedure and reintroduced it as this is something for the sake of others that has to be done. Wow, says Brandon Robinson, what a contrast in perception. It's said that a patient's attitude could aid in a positive outcome. Brilliant.
Well, that's true. Always this saying, the fear of the unknown. I think once people see what's going on, once they get over the initial emotional thing about seeing blood, or it really becomes a very normal thing once you're exposed to these things. And I think the big emphasis now in the United States is they're talking about patient-centric medicine. And we see a lot of that in social media, patients discussing this, patient advocacy groups, and
Did you put a timestamp on the start of the procedure? Because we're 10:19 now Pacific time. 50 minutes, is it, or just less? 45 minutes in?
I just had a notice from Google asking me if I was still in the conversation, so I answered yes. I guess they have a time limit on that.
Well, that's an hour, 90-minute one, isn't it? But I think. I took a screen cap at 36 on the hour, I think.
Mm-hmm.
There's Maria. Hey Maria, how you doing? She's frozen, actually.
Yeah, Maria, can you hear us okay? This is Dr. Levin. We're in the middle of a procedure here in the operating room, middle of a thyroidectomy.
Oh my gosh, is Hermine there?
Yes, but you're very faint.
Okay, just want to check.
Mike, go ahead and talk with her. I'm doing something else here on my Twitter stream.
Can't hear you, Maria, very well at the moment. Just trying to have the chat open either, was she? Maria, if you can hear us, everything's going fine here, but we can't hear you virtually at all. You will see two screens.
Okay, all right, I can hear you. Thanks for the update.
I think she's on an iPad. So we've got one screen, we've got two webcams going, one... Okay, fair enough.
Yes, they do. Right.
That's in the middle of her other program. I think she goes out live at 10 AM for her regular show. The Hangout thing is just next. Exactly, yeah. So it's,
I actually made that one up yesterday. Good.
So you can meditation on.
Exactly. It's running very smoothly, and they're probably cleaning things up and making sure everything's in place. They're probably getting ready to close very shortly, if they're not already. We've been here, what, about an hour? Well, they'll close some of the deep tissue with stitches. Sometimes they'll use staples, but most of the time the skin is closed with these very tiny little staples, which come off the next day or 2 days later. No, actually they use absorbable sutures. They'll just absorb and go away. I didn't mean to say staples. No, they won't take those out. It'll all be absorbable cat gut or absorbable artificial synthetic suture.
there is a thyroidectomy on YouTube I was watching earlier, and that had like a double set of stitching, which I thought was really good for the second set because it brings the skin really up tight with each other. I think I'm frozen, so I might have to go back out.
What I've done is I've actually put this thing up as a link in my Twitter stream. There's a group of people that follow me. They're physicians and also healthcare consultants, so they'll be able to have access.
Check it out, guys. Check it out.
There it is. Wonderful. That's it. Oh, that's great. He gave us such a great view. Yeah, it's a fairly large gland. And of course, hers is probably enlarged because she's hyperthyroid. Her gland has gotten larger. There it is. That's a great view. Yeah. No, it looks healthy. It gets dark because it only stays bright red when there's oxygenated blood going through. So as soon as the blood flows around, it's going to turn dark like venous blood. So it turns purple. Oxygenated hemoglobin is much bright red. It looks like we lost Mike Downs. No, there's not that much blood loss. I'd say there's probably maybe less than 100 cc's of blood loss.
Not bad for 40 minutes, 12 hours.
The doctors have left the room, literally. I think he went over to look at the gland. He probably went over off the table, and he probably felt it, and it may have made an incision to look inside the gland to make sure there's no tumor or nodule or something like that. That's probably what just happened. I think he's back in the feed. He's back on the right. He took off his loops. He's come back, but he's taken off his operating loops. The assistant has them on now. I have a feeling they're getting pretty close to the end here because I think his assistant's closing up. This little baster he's holding in his hand is an irrigating syringe. They're irrigating the wound out. So I think they're pretty close. There we go. It shook hands on it. The assistant surgeon shook his hands because he did such a great job, and the surgeon shook hands for thanking him.
Okay, let's see.
Mike, you just joined us again. They're just about done. They did a handshake. You missed the handshake. There we go. They're happy.
Working next week?
Yep, it's time to go. It's time to send the bill.
Sorry. Anytime you're ready to count, guys.
Doctor, if they can hear us, Dr. Duperior, thank you very much.
That's 1, 2, 3, 4, 5, 10.
They're counting. They're counting gauze pads. They probably had some absorbable pads, and that's the proverbial sponge count. Did you hear her counting there? Yep, they want to make sure there's nothing left in there. That's one of those never events. They have these little metallic strips in the sponges, so if they're left in, they show up on the X-ray. Now, if that sponge count is wrong, they will open the wound and go looking for it. No doctors like. No doctors likes to do that, and if it happens, excuse me.
I never said anything about that. No, I don't have to do that. I mean, I was objecting to people that
The money shot was when I left, was it? Is that what it was? I held it up and I was gone. I am so disappointed today.
Samuel's in there off the way. You're out of your talking.
Yeah, she's retired. She's a nurse. She used to run my office.
Who's retired? Me?
Yes.
No, I'm now a full-time homebody
Did you hear what she said?
with 4 men.
She's denied being retired. She said now she works even harder taking care of me, and we've got 3 adult children living with us. It is. Great. Wonderful wife. Wonderful wife. I've been very fortunate.
No, I had it yesterday too. I don't know what's
This brings back fine memories of when I was in the operating room a lot.
Have a look at that image in the chat window, see if it's possible to share it.
You'll notice that the tech there is wearing a mask, and there's actually a what do you call it? Polyethylene plastic visor, so blood doesn't splash up and get them in the eye.
Not all Indian men are smart.
Wow. What the jokes?
That was pretty wild.
Maybe you could just put a sign
Well,
on
that's a,
yeah.
Oh yeah, I bet.
a lot of these TV shows are exaggerated. That's a great screen capture, Mike. You got to save that one.
Am I allowed to share that, do you think, now?
I think so.
Okay. Just sets the scene with our thumbnails at the bottom.
Yeah. That's good.
Okay. Not on your 15 screens there, Dan. You can't.
Turn it on. No, the whole thing. I would just close it. Everybody agree with just close it?
So if I can do some regular screenshots now, you know, and just tell the story a little bit, maybe.
All right. You guys have any questions? Well, I'm sure you do, but, you know.
Is that?
Everything went very well. Yes, sir.
Yeah, how did that gland look? Were there any nodules in the gland? This is Dr. Levin. It looked like fairly
Yes.
enlarged, a little bit enlarged.
It did. It was enlarged.
Very smooth found the parathyroids.
Very smooth. The parathyroids were found.
Both nerves identified.
Both nerves were identified. Good surgery, I believe.
Yeah, it was really great. The only difficulty we had was the lighting. We couldn't really see a lot of distinct parts of the wound because the lighting was so bright that the camera.
Oh, yeah. The glare, we noticed that right away. You know, my partner's really into all this. He would have been awesome to do it. I'm going to mention it to him. So.
Well, I'm sorry we had the problem with the administration at the hospital. I kind of figured they'd want somebody.
New. Anytime there's something new.
Yeah, well, actually, next time we do one of these, we're going to involve the people from your medical photography department.
And well, nice, you know, very interesting to me.
I think we
y'all
can
Spurs fans? All right, we'll be signing off. Thank you.
Thank you very much.
Pleasure's all mine. We'll take
And
it.
be sure you thank Dr. Duperior for, I don't know if I'm saying that right, for allowing us to do this.
We call him Dr. D.
Yeah, this will probably be up on YouTube. If you can send us your email, we'll make sure you get the information.
Okay. Definitely. All right. Y'all ready?
Thanks so much. Bye-bye.
Bye-bye.
Bye-bye. Well, that was really, I think they got a big kick out of that, and I think a lot of people are going to hear about this. This is going to spread through the hospital like wildfire.
Let's let the other one on.
He said they're going to put it on YouTube.
And
I don't want to send them there, but it's very glary, I thought.
Chris, what about this one?
Just close it up, I guess.
Close it up.
just hit the exit button.
Disconnect the cord.
Well, this is going to spread like wildfire through the doctor's lounge and among the surgeons, and I think a lot more people are going to know about Google Hangouts now. No, at the end or at the end? No. So I have to leave too. Thanks for inviting me to this, Dan. And even though it didn't go the way Hermine wanted it to go, it went as well as I thought it would go. And maybe the next time we'll be able to do it.
Yeah, I think it was great, and even though it wasn't live, it was still fantastic, and you did some really excellent explanations, Gary.
And Dan, I think Mike and Dan, since you're broadcasters, you kind of know how to bring out the things, and sometimes being a physician, I take a lot of things for granted, and I think you bring it down to the ordinary person's level.
Do you hear that, Dan?
Very good.
Yeah, no, brilliant. Levin.
Right. 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 I'll be able to use some of this. Actually, I'm going to bring some of this into grand rounds at Loma Linda University, where I've been on the faculty, and I'm also going to put this up on my medical blog. And so we'll kind of get the word out. And we'll probably have some requests for us to do this again, I'll bet.
If I were you, I'd take a breath. Pull your tongue out. Yes.
Hmm. You're welcome. Can you copy me into the link? Because I missed the really good bit, didn't I? How long will it be before rendered? Yeah, no worries. Okay. Yeah, okay, right. Yeah, see you soon. Yeah.